We're going to be talking about diseases and disorders of the integumentary system. First thing we're going to talk about are skin lesions. First one is a burrow. This is a tunnel or streak caused by a burrowing organism, such as a spider burrowing. A comedone is a mass of sebum, keratin, and debris blocking the opening of a hair follicle. It's also known as a blackhead. So that says a little in there. Crust is liquid debris dried on the skin surface. It results from ruptured vesicles, pustules, or bullae. A cyst. This is a nodule filled with either liquid or semi-solid material. It's a thick-walled, closed sac or pouch containing fluid or semi-solid material. It's an epithelial-lined cavity. Examples are a pilonidal cyst. This is found over the sacral area of the back in the middle and contains hairs. Or a sebaceous cyst, which is a collection of yellowish, cheesy sebum commonly found on the scalp, vulva, and scrotum. Erosion. This is a wide but shallow fissure. And a fissure is a small, deep, linear crack or tear in the skin, and you can see that right here. A keloid is a raised, irregular, and increasing mass of collagen. Results from excessive scar formation. Lichenification. The skin has a thick, dry, rough surface, and it's leather-like. It's right there. A macule is a small, flat, circumscribed lesion of a different color than a normal skin. And if you have a lesion or something that's circumscribed, it means it has a definite border. Some examples of this are freckles and flat moles. A nodule is a palpable, elevated lesion. It's solid. It's greater than 5 centimeters in depth and diameter, and it's differentiated from a papule by its depth of involvement. Some examples of this are enlarged lymph nodes. A papule is a small elevated lesion. It's solid, but it's less than 0.5 centimeters in depth and diameter. The majority of the papule projects above the plane of the surrounding skin, and an example of that is a pimple. Plaque is This is a large, slightly elevated lesion with a flat surface. It's often topped by scale, and it's greater than 0.5 centimeters in diameter. Plaques occupy a relatively large surface area in comparison with its height above the skin. A pustule. This is an elevated erythematous lesion. It usually contains purulent exudate or pus. An example of this is a small abscess. Scale. This is a thickened outer layer of the skin. It's dry and whitish in color. An ulcer is a cavity with loss of tissue from the epidermis and dermis. A vesicle or a bulla is an elevated thin wall lesion containing clear fluid, such as a blister. A vesicle is less than 0.5 centimeters in diameter, and a bulla is greater than 0.5 centimeters in diameter, so that's a large vesicle. Okay, now let's talk about dermatitis. We have seborrheic dermatitis, and this is an inflammatory condition of the sebaceous glands. Results from an overproduction of skin cells and sebum. When it appears in infants, it's called cradle cap. Contact dermatitis. This is an acute inflammatory skin response. It's triggered by an exogenous substance. There are a range of reactions that result from skin contact with a foreign substance. It may appear as an itchy, red, swollen, or blistery rash after contact with an allergen or irritant. atopic dermatitis. This is also called eczema. It's a chronic inflammation of the skin, erythematous papovesicular lesion. And I have eczema on my right hand where the palm is right by my thumb. And it doesn't hurt, but it itches like the dickens. Okay, now, urticaria. This is also known as hives. It affects the dermis. It's an acute hypersensitivity reaction. A vascular reaction of the skin causes intense itching and rapid inflammation as a reaction to foods, medications, or other external irritants. An eruption of wheals, which are smooth, slightly elevated edematous area that is redder or paler than the surrounding skin. And you see this is the urticaria, okay? So this is a slightly elevated lesion, okay? Psoriasis. This is a chronic skin condition. It presents with thick, flaky, red patches of various sizes, and it's covered with white, silvery scale. It's familial and may be worsened by anxiety. So they're raised red patches covered with white scale. It's neither infectious nor contagious, but is caused by an increased rate of growth of the basal layer of the epidermis. The skin cells multiply up to 10 times faster than normal. As underlying cells reach the skin surface and die, their sheer volume causes raised red patches covered with white scale. So that's the scale we saw before. Rosacea is a chronic inflammatory disorder of facial skin, causes redness primarily in areas where people blush. Acne vulgaris, and vulgaris means ordinary. This is an inflammatory disease of the sebaceous glands and hair follicles. It's caused by the buildup of sebum and keratin in the pores of the skin. A blackhead or a comedo. This is a sebum plug partially blocking the pore, and a whitehead, the pore is completely blocked. Herpes zoster, shingles. It's an acute inflammatory dermatomal eruption of vesicles. It's extremely painful and can appear on the trunk of the body or on the face. Impetigo. This is a common contagious superficial skin infection. It's caused by Staphylococcus species or Staphylococcus aureus and Streptococcus species or Strep pyogenes. It's characterized by vesicles, pustules, and crusted over lesions. Furuncles and Carbuncles. This is also known as a boil. It's a pus-containing abscess. It involves the entire hair follicle and adjacent subcutaneous tissue. Now, a furuncle, which is the first one, is a localized pyogenic infection most frequently caused by Staphylococcus aureus originating deep in the hair follicle. And a carbuncle, which is this one, are several furuncles developing in adjoining hair follicles with multiple draining sinuses. Deep-seated pyogenic infection of the skin and subcutaneous tissues, usually arising in several contiguous hair follicles, which means several that are together. Cellulitis. This is an acute diffuse bacterial infection of the skin and subcutaneous tissue. The bacteria enter skin surface through a small cut or lesion. It's usually caused by either Staphylococcus or Streptococcus. Now, the dermatophytoses. These are chronic superficial fungal infections of the skin. Okay, Tinea capitis, corporis, unguium, pedis, and cruris. And these are known as keratinophilic fungi. They keratin lovers. There are 3 genera of dermatophytes: the trichophon, trichophyton, microscorum, and epidermophyton flocosum. These produce extracellular enzymes called keratinases, and it's why they're capable of hydrolyzing keratin. The superficial or cutaneous mycoses are usually confined to the outer layers of the skin. Okay, so tinea capitis, we have round, gray, scaly lesions on the scalp. Okay. Tinea corporis, which is ringworm, we have round, ringed, and scaled with vesicles. It's funny, I used to work for a vet clinic when I was younger, and if we wanted to see if the animals had ringworm, if we couldn't tell, we would just look at the owners, and usually they would have it. So yes, you can get that from your pets. Tinea unguium is the affected nail or nails appear thickened, brittle, and lusterless. Tinea pedis, another name for that is athlete's foot. The skin between the toes and soles of the feet can become inflamed, dry, and peeling, and fissures may develop. There's intense burning and itching. And the last one is tinea cruris. This is also known as jock itch. You have raised red pruritic vesicular patches with well-defined borders in the groin area. And that's it for this part.